And now we hear the differences between home health services and hospice. Welcome to Community Crossroads.
Thank you.
It's great to have y'all here. Kathleen Card with Hospice of South Texas and Dr. Meyer. It's great to see you again.
Thank you for having me.
So I want to explore the differences between home health services and hospice. Can y'all illustrate those?
Sure. So when you're looking at home health, we talk about sometimes in the hospital, for what I do, we talk about what our goals of care are. And when you have patients that still would like to get stronger, they think they have the will to get stronger, you know, they talk about different types of rehab and the things that they can do. Sometimes they think, oh, I don't think I can go somewhere for rehab. So we talk about home health doing rehab at home, and they can do rehab, they have wound care, things that patients may need but cannot get out to go do those things. And it's basically to help them get stronger and better. And so, and we have an amazing amount of home healths here, so there's lots of options. Of course, it depends on the insurance that you have and all those things, but there's a lot of ins and outs that they can do for patients to help get them stronger and better.
And Dr. Meyer, what are some of the signs that you may see when you're receiving home health services and maybe it's time to go to hospice?
Yeah, as you're going through with the treatments, the wound care or the rehab, the physical therapy, if you're not reaching the goals that were established when you started that care, sometimes the home health will bring up that things aren't working like we had hoped, or patients or families may notice a change and they're, you know, from prior experiences with home health, they felt better and stronger and were able to do well on their own, but they're not seeing that same result, perhaps. Then that would be the time to discuss with their physician if maybe transitioning to a different goal with hospice and focusing on comfort might be a better path.
And hospice is an inpatient kind of service.
Well, it depends on where you're going.
Okay.
And so we do home care as well. So we go into the home and we have our registered nurses, our LVNs, our certified nurses aides. I always tell people you're going to have just a large amount of, we consider it family, because we all have worked together for so long, but you have our family coming to you. And if there's a time where you need a little bit more, your symptoms are not under control at the house, or sometimes we're coming straight from the hospital, then they can go to our inpatient center to get things under control, like pain management, agitation, nausea and vomiting, some of those things that we may need to work a little bit harder on those things before we get them to the home care setting.
And what some general advice would you provide to a family maybe preparing to place a loved one in hospice?
Well, first of all, the stereotype of hospice is when you say end of life, people go, okay, so like we're dying tomorrow or the next day or the next day. End of life can mean a very, you know, extended period. It just depends on the type of illness that they have and what their bodies are doing. So we want to have people on services for an extended period of time so that we can talk to them about, you know, their psychosocial things, preparing them for all the different changes that could happen. And in particular, preparing the family as well to get them ready to be comfortable with what's going on with the patient.
There's a bit of a social worker aspect to it.
There's a large social worker aspect to it.
It's a team.
Yeah.
I don't think of hospice as a place in particular, more of a philosophy of care, and it involves a lot of different team members, different disciplines, between social workers, like you mentioned, for psychosocial care, for help with insurance questions, or if we need consider nursing home placement, but also our chaplains.
That's right.
to provide spiritual support to patients and their families, along with our doctors and nurses aides to help with all the physical care.
And volunteers, can't forget those either.
That's right.
Oh, volunteers, you can volunteer.
Yes, absolutely.
Where can someone learn more if they want to sign up to volunteer?
They can call our office and talk to Kim Moore, who's our volunteer coordinator, at 361-572-4300. And there's all sorts of types of volunteer work. We have our ladies that work on our prayer shawls that each of our patients gets, and there are what do we consider patient companion?
Support companions. They go into the home just to spend time, just to talk to people, read to them, read the Bible, or pray if the patient's unable to speak. Just giving that personal touch And we've got well over 100 volunteers throughout our 12 counties that go out and see patients, that help at our Dornberg Center, and that do paperwork, maybe office work in the office if that's what they're called to do.
Well, we'll get a closer look at the Dornberg Center here in just a few minutes on Community Crossroads. Thank you all so much for coming on the show.
Thank you.
Thank you.
All right, coming up, don't go anywhere. We are coming back with more Community Crossroads.